Today we heard two studies looking at the impact of lifestyle interventions on different kinds of endpoints in breast cancer survivors. The first study looked at exercise during cancer treatment for women with early breast cancer. We know that women with breast cancer often have low cardiorespiratory fitness. That's measured through things like a stress test and things like that, and it can actually be predictive of not doing as well after your cancer diagnosis. We know that chemotherapy has a pretty profound impact on cardiorespiratory fitness in breast cancer patients that may last for years after the treatment's finished. And there's actually been a fair amount of work already that's looked at exercise programs during breast cancer treatment. There was a meta-analysis published a couple years ago of 15 trials, more than 1,000 women, showing that if you exercise during treatment, it helps maintain your cardiorespiratory fitness. So the trial that was presented today was a larger trial than the studies that had gone before it. It randomized about 500 women to an exercise program during their chemotherapy or to a usual care control group. And what it showed was very similar to the results of the meta-analysis, that women who took part in the exercise program had improvements in their fitness as compared to women who were not in the exercise program. And this was really true for all the women in the study, whatever kind of treatment they got. If you were somebody who didn't get chemotherapy, there was actually an improvement in your fitness level from before your diagnosis as a result of participating in this program. For women who received chemotherapy, I think the results were even more profound because chemotherapy can cause such a decline in cardiorespiratory fitness. And so what they saw was that women who were in the exercise group, their fitness levels dipped down as well, but they recovered more quickly and they got back almost up to baseline, whereas the patients who had just gotten the chemotherapy without the exercise program did not. So I think yet another reason to tell women that it's important to exercise during treatment. So the Success-C study was a large trial that was conducted in Germany, and it was actually part of a really innovative trial design where about 3,500 women were enrolled in the trial and given one of two chemotherapy regimens, and that was sort of the primary part of the trial. But women who had a body mass index of at least 24, which is in the normal range, but toward the top of that, up to 40, were then randomized to take part in a weight loss program or a usual care control group. About 2,200 of the women met that criteria and participated in the weight loss program or control part of the study. The study, unfortunately, overall did not show that randomization to this weight loss program had any benefit in terms of reducing the risk of recurrence or survival, but there were a lot of important caveats. The intervention only caused a very modest amount of weight loss, a few pounds in the group as a whole. People who stuck with the program did a little bit better, but unfortunately that proportion of people was also less than half of the patients that were assigned to the weight loss program. And so both of those things make it really hard to make any firm conclusions from the study, because it's sort of like a drug. If people don't get that drug, you can't really say whether the drug is working or not. And I think it's the same thing with this trial, because people didn't lose weight and a lot of people dropped out. It's hard to make any definitive conclusions. But the thing that was interesting, and again, this is highly selective, but if people did stick with the program in general, no matter which group they were in, they did a little bit better. And if they had been assigned to the weight loss group, they did a little bit better still. So hard to know. The other piece that's important was there was a lot more women that dropped out of the weight loss program than the control. So those groups are probably different. The one thing I want to say is that I don't think that sort of the concept that losing weight could improve outcomes is one that we should move away from. And our group is actually leading a larger scale trial here in the United States that's a standalone weight loss trial for women who are overweight or obese when they're diagnosed with breast cancer. It has a similar design to the second part of that trial. So women are randomized to a 2-year telephone-based program or to a control group. But the differences are it's a bigger study. You have to weigh a bit more in our trial because the connections between weight And cancer outcomes are really seen in women who are obese and not as much women who are leaner. And so in our study so far, 3/4 of the patients have been in the obese range. And the other difference is that our intervention is a lot more intensive. We worked very closely with some of the leaders of the big diabetes weight loss trials that were done. And so instead of 19 phone calls, we have 42 phone calls. Our intervention is based on a theory of behavior change. And so far, and again, our trial's ongoing, we've enrolled about 1,700 women over the last 2 years. We've seen really high adherence and good weight loss. So we're hoping that this study in a few years will give us a bit more information about the power of weight loss to potentially reduce recurrence. Well, I think that we have a lot of information that tells us that exercising, choosing a diet that has high in fruits and vegetables, lower in meats and processed foods, keeping your weight in a good range, all the things that the American Cancer Society already recommends. We have lots of evidence that those things help with fitness and with quality of life and with changes in some of the biologic factors that we think connect weight to breast cancer. I think we don't have definitive information yet that says this is the program people should be on, or you really need to do this to improve your overall risk of recurrence and mortality. I think we will get that information in the next few years. I encourage my patients to be as healthy as they can. I think I especially encourage people to exercise throughout their treatment. In addition to all these benefits for fitness, there's a lot of other things. There's less fatigue in people who exercise. So there's a lot of concrete benefits. I think what we're still waiting on is how does this all impact recurrence? I would just also encourage patients to participate in clinical trials. Sometimes people say, oh, it's diet and exercise, do we really need to study that? And I think this is really the only way that we're going to figure out, should these types of things be a routine part of the way that we treat our patients? And if it should be, how do we actually provide those programs to our patients?